This is Josh Halls doing a neurological exam for MSN 572. This is Jessica, my patient. We're going to ask for her consent to post this video.
That's fine.
Okay, and then I'm going to walk into the room. Here we go. Knock, knock. Hey, Jessica, my name's Josh. I'm going to do your exam. I'm just going to wash my hands.
Might have to talk loud.
All right. Yes, we might have to talk loud. Okay, so I'm Josh. I'm the nurse practitioner going to be doing your neurological exam today. How are you feeling?
Doing well.
Good. Hey, do you know your name and date of birth?
Jessica Halls, 4/1887.
Okay. And do you know what today's date is?
February 13th,
Okay. And what day of the week?
Sunday.
Do you know who the President of the United States is?
Yes.
Who?
Biden.
All right. So noting there, we can tell that the patient is alert and oriented. She's making eye contact. She's sitting up straight. And she knows, obviously, she is alert and oriented to time, place. And do you know where you are?
I'm at the doctor's office.
Our house. Perfect.
Sorry, our house in a fake doctor's office.
Okay. Perfect. All right. Next, we're going to do memory. I'm just going to have her, I'm going to say 3 words and then she's going to tell them to me. So I'm going to say apple, banana, and orange.
Apple, banana, orange.
Okay. And then reasoning, clinical reasoning, I could ask a question. If you had a child walking across the road and a dog walking across the road and a car was coming, who would you go save?
My child.
Your child. So that's pretty good reasoning. Okay. And then we're going to jump into our 12 cranial nerves, starting with the first one, olfactory. What I'm going to have you do is close your eyes and close one nostril
Like
with your finger. Yeah. I'm going to have you smell this and tell me what it smells like.
A grapefruit.
Grapefruit, nailed it. Okay, and then do the other nostril and tell me what you smell here.
Banana.
Super ripe banana.
Mm-hmm.
Okay, so olfactory senses are there. She can smell with both nostrils. Okay, now we're going to move on to the second cranial nerve, which is optic. And I'm first just going to have you do this chart that we did last time. I'm just going to have you do it with your eyes open since we did it last time. Just read the chart that you can read the lowest on.
LTFPH.
Okay, perfect. And then oculomotor would be the third one, which we can actually test for oculomotor, trigeminal and trochlear at the same time by doing the eye movement. So we're just going to have you start with this pen light. I just want you to stare at it, and we're just going to move you back and forth, making sure that the eyes are moving with the pen. And then one last one there. Okay, now what I'm going to do is go back to the optic, and we're going to look at pen light here, looking at pupil dilation. Okay, so look at my nose. So pupils are equal, round, and reactive. Perfect. And then I'm going to shine the light on the right eye, but pay attention to the left pupil to see if it converges, and also, which it does. And then same with that, looking at the right eye as I shine in the left to see if the pupils constrict together. Okay, now we're going to test for peripheral vision. I'm going to just start with my hands kind of behind her head where she can't see, and then move my fingers, and she'll tell me when she can see my hands.
Okay.
Okay, how many fingers am I holding up?
2.
Nailed it. Very good. Okay, so then I'm also going to test convergence here. So I'm going to move this pen light in. Right there is when her eyes kind of move in and converge together, which is good. Moving on to we did the trochlear with the movement and the trigeminal also with the eye movement. And now we're going to do facial. So I'm going to just take this, we're going to just touch her face and see if she can feel that. You feel that on your cheeks, your forehead?
Yep.
Okay. Can you scrunch your eyebrows? Puff out your cheeks. Perfect. That's part of the facial and abducens. And then facial abducens, and then the vagus nerve, and then the glossopharyngeal nerve, which I'm going to have you open. Say ah. I'm going to go ahead and use my pen light here. Ah again. Making sure that uvula is moving up and down. And then spinal. I'm going to work on that sternocleidomastoideus muscle there. I'm going to have her just move her cheek as I hold my hand, move against my hand. Any pain, anything there?
No.
Okay, doing both sides. And then also have her shrug that spine as well. And then the hypoglossal, which is the 12th cranial nerve, I'm gonna have her stick out her tongue and just move it up and down there. Perfect. Those are the 12 cranial nerves. I'm moving through them pretty quick because you can see that pretty healthy patient here. Okay, we're gonna move on to motor, well, working with her gait. You might not be able to see it, but what I'm gonna have her do is stand up and just walk across the room. Walking pretty normal. Now as she's walking back, hold on, I'm gonna have her do walking heel to toe. So I'm gonna have her put her back heel to the front of her toe and just kind of walk, making sure she stays balanced. Okay, now walking back that way, I want you to walk on your heels only. Nice. Walking back towards me on your toes only. Wonderful. Okay, now standing up, I want you to close your eyes. Okay, she's staying balanced, not swaying back and forth. That's really good. Okay, go ahead and sit down. We're gonna test her motor movements of her arms. I'm gonna have her take her hands out of her pocket there. Go ahead and up towards me with your biceps. We're gonna test the motor of her biceps and then triceps. I want you to push against my hands. Good. We're gonna test the sense of her hands. I'm gonna have her do a soft touch with this Q-tip and a pin prick with this pen. We'll first test her hands. Close your eyes. Does that feel soft or pointy?
Soft. Hard. Soft. Hard. Soft. Hard.
Probably pretty hard to tell with her sleeves on. I didn't normally have the patient take them off. We'll test her lower legs at the same time since we're already working here.
Hard. Soft. Soft. Hard. Soft. Hard.
Perfect. So her sensory of both soft and hard things are, and then what we'll do is we'll take these two tips and we'll see if she can tell the 2 points as we.
2. Am I supposed to say 2? Or
Yeah. How many points can you feel?
2. 1. 1. 2.
Perfect. Okay, we can also test for grapthesia, where I'm gonna have her close her eyes. I'm gonna draw something on her hand.
8. 3.
Perfect.
Is that right?
You are right. I did forget the acoustic cranial nerve. We'll test that now with this, which we did last time. I'm only going to test one ear, but we would normally do it for both. So you can do the Rini whisper test, the Rini, and the Weber test. Weber test, we go above her ear, make sure she can hear both equally in both ears.
Yeah.
And then this one, the Rini test, is where you test the bone conduction versus the ocular conduction. And if the bone conduction is higher, then we know we have an acoustic issue. So I'm going to tell her to tell me when she doesn't hear it anymore.
Okay.
And you can still hear it there. So that's a good sign. When we bring it back to the ear, you can still hear, which means the acoustic is greater than the bone density. Okay, now testing the lower half of the body as well. Now what I'm going to have you do is, you can't really see it that great, but I'm going to have her move her hips, her knees out against resistance here. Any pain on those hips?
No.
And then back in towards my hands?
No.
Perfect. And then working on the quads and the hamstrings. We can just do that from a seated position with her feet. I'm going to have her push against my hand here for the quads and then back towards herself for the hamstrings. Any pain, any issues? And the right leg as well. Okay, I'm also going to do it with her feet. So I'm going to have her toes push against, back, side to side. So any pain?
No.
Any pain that way?
No.
Side out?
No.
And back in?
No.
Any numbness or tingling running down the legs?
No.
Numbness and tingling would show that there could be a compression of any discs in the lower back. That's a great question to ask when you're talking about neurological, spine, and everything like that. We're going to test our deep tendon reflexes as well, going from the brachial to the radial, triceps, just hitting all the major joints, making sure that they are intact. get that little flexion, we know that the tendon's intact. Ulnar, when you hit the ulnar, you'll see that hand flinch a little bit. We'll try the tricep as well. Getting those movements. And then we'll move to the lower body, working on the knee. And then we'll move down to the Achilles as well. Okay. All right, that is my neurological exam for MSN 572. Thanks, Jessica.
You're welcome.